a secret, and you might too. 'Cause 1 in 3 women tell me it's true. And it's embarrassing if you do have incontinence.
Hey everyone, I'm Dr. Mache Seibel, professor at the University of Massachusetts Medical School and director of the Complicated Menopause program there. I hope you like that little song that I was playing as an introduction called I've Got a Secret. And you know what the secret is that my friend Joni was singing about? Loss of urine. Did you know that 1 in 3 women has some kind of urinary problem where she's losing urine? But here's the secret. Women wait between 5 to 7 years to talk about it with their doctor. Think about that. Women are going to be suffering for 5 to 7 years before they ever even bring the problem to their doctor's attention. That's terrible because all these new things that are happening on a regular basis that can help you overcome this problem are not getting taken advantage of. And that's the one take-home message I want you to get from this video. Incontinence and urinary control problems are treatable, but you've got to tell somebody, shh, don't keep it a secret. Let's talk just a little bit about it. Today I'm going to just provide you with an overview with the hope of in making the single point talk about it. But I do want to tell you that there are at least 3 kinds of urinary bladder control problems. They fall into basically 3 categories, and this is what they are. Number 1, a lot of women will have trouble getting to the bathroom fast enough. They just have to go, all of a sudden, there's a tremendous urge to go. So the medical community calls that urgency. Now there's a second one, that the woman has to go too often. You must know, ladies, that are friends of yours who know every bathroom in every department store and every office building that they work in and so forth. It's really that kind of thing. So that's called frequency. These kinds of issues are very important, they're very common, and they are not particularly distinct in menopause. As a matter of fact, young women who've never had children can have these problems, and they're not that uncommon. As I mentioned, 1 in 3 women is struggling with some kind of urinary bladder control. Those are things that you can talk about, and we're going to talk about in detail in future videos. The third category, which is more common in menopause, is called incontinence. And in that situation, what happens is you cough or you sneeze or you go out and do exercise, you play tennis or do something, pick something up, and the pressure that you exert when you're doing those activities causes urine to be lost. Let me explain briefly what causes that. You know, the bladder is sitting right on top of the vagina. And what happens is the following. If you think of the bladder as shaped like this, where this is the bladder and this is the urethra, the little tube that lets the urine go out, typically when you increase pressure on top of the bladder through an activity or through exercise or through anything, coughing, sneezing, and so forth, when you press down with the increased pressure, that's going to kink the urethra. It's going to make the little tube that goes out actually kinked so that the urine doesn't flow. But when you have incontinence, what's happened is generally from a result of childbearing, having kids, or it doesn't have to be that, it can be other things, or some people just born with weakened tissue. The muscles underneath the bladder begin to get weaker, and the bladder begins to drop. And as a result, the pressure, when you take a cough or sneeze or increase the pressure, it's actually forcing the urine over the urethra, out this little sphincter muscle, and because it doesn't kink anymore, it's just creating a pressure, the flow goes out, and that's what happens. So there's a number of kinds of things that you can do about that. Incontinence can be controlled by something very simple, like putting in a pessary. A pessary is kind of like the diaphragm that's a birth control, but it's not a birth control. It's a kind of mechanical thing that goes in the vagina and lifts the bladder back up. And as a result of that, it's possible to restore the normal anatomy, and for many women, this will fix the problem. Of course, the woman does have to wear the pessary, and then you have to reach in, pull it out, and wash it in warm water and mild detergent every week or so to keep it clean. But there are a number of other things that can be done. There are also stimulatory new techniques of stimulation in which you can actually stimulate the muscles that are around the urethra and around the bladder. And these kinds of activities, these things are done, and they allow the increase in strength of those muscles, and it's possible then to have extra control through those techniques. And they do work for a number of people. And the thing I want to emphasize here is that the techniques are changing a lot. And just in the last few years, there's been a lot of new technology that's been designed to help women with this very common problem. Another area that can be done is Kegel's exercises. They're not as effective here, but let me explain what they are. Dr. Kegel came up with the notion that you could strengthen the muscles like any other muscle just by exercising them. And here's how you do that. You just go to the bathroom, and when you're urinating, squeeze the muscles so that the urine stops flowing. Now you know exactly which muscles control the loss of urine. So what you do is at any time during the day, could be in the car, could be during a television commercial, could be any time you want, you squeeze those muscles 10 times, at least 3 sets of that sometime during the day. You can do it more often. You can do 12 or 15 squeezes, but you want to get at least 10 to 12 at least 3 times a day. And what that will do is to strengthen the muscles, and you will find that within 2 weeks anyway, 3 weeks, you'll know if that particular exercise regime is helping you. Now the last way I want to tell you about is one that is a surgical approach. The thing about surgery today is in the past, surgery was much more major. A lot of times the surgery for this kind of problem involved rather large incisions in the vagina or an incision in the abdomen, and it required quite a bit of recovery. Today, there's a whole field of medicine called urogynecology. These are gynecologists that specialize just in the urology and the urinary tract of women, and there are techniques that are very minimally invasive that allow the bladder to be lifted up and restored just as a day procedure with very rapid recovery. So all of these techniques are open and available to you. Now, I always tell people that the difference between major surgery and minor surgery is that major surgery is any surgery they do to me. So I understand that surgery is always major in a way. But the wonderful thing is, compared to what it was in years gone by, it's so much better. So, if you've got a secret and you're losing urine, take away from this video, don't wait the 5 to 7 years that most women are waiting. Because if you just look around a room, anytime you get 10 women together, 9 women together, you can be certain that 3 of those women most likely are going to be having urinary difficulties, and they're not saying a word. Don't be one of those ladies. Go to your doctor, talk about it. If he or she isn't able to help you specifically with this problem, look for a urogynecologist who can help you, or other people who specialize in this particular field. I hope this has been helpful to you. We're going to have additional videos that are going to be coming out with more information about urgency and frequency, and I will go into more detail about a whole host of things with bladder control in future videos. In the meantime, please leave me your name and your email address, because I'd like to send you updates in terms of when these new videos are coming out, when we have new ebooks released, when we have links to new videos on different topics that may be of interest to you. And the way I can reach you is by leaving your name and your email address. So I hope you'll do that now. In the meantime, remember, it's better to stay well than to get well.
Incontinence.